What is going on, everybody? Okay, this is going to be our first lecture for the semester. I want you to go real quick on Canvas. If you're logged in right now, go into Files, and I want you to open up the Intro to AT PowerPoint. So you're going to basically follow along with me. I kind of went back and forth on what I wanted to do with this, whether or not I wanted to give you blank slides and then you guys take notes. I just don't like that. So I want you guys, please pay attention and follow along with me. I promise these lectures won't be very long, but just make sure you understand some of these talking points because they will be on the quiz and they will be on the first midterm as well. With that being said, while everybody's getting ready, just a more introduction about myself, I guess, in that video. Hopefully everybody understood that video. I haven't been getting a lot of emails, so that's great, you know. I guess a little background about myself. The biggest question is, why aren't you an athletic trainer anymore, or why don't you practice? I still do practice. I still do, work for UK every now and then. It's kind of like a floating athletic trainer. So when one of my friends or my old boss calls me up and somebody's sick or something like that, I usually take in for them. I'm still certified. I'm still licensed. I just got out of the profession, not altogether, but I wanted to start my own business. And so what I did was I took the best of both worlds. I have a master's in strength and conditioning, and I wanted to basically introduce prevention exercises to athletes and patients that we used to see at the clinic that just had post-op knee or post-op ACL and stuff like that, and try to basically minimize to the general population. So I opened up a gym, and I have it located in my hometown of Versailles, Kentucky. And it is a franchise, so if you guys are familiar with it, it's workout anytime. You guys are more than welcome to come by and say hi one day and see exactly what I look like and how goofy I really am. So, but anyway, it's just a little tidbit about me. Like I said, I have been teaching this class since 2013, and I still keep up to date big time with the profession, so I haven't completely walked away from it. But I will say it's a lot more stressful being your own boss and not working for a big organization like UK. But I left on good terms. I'm still here, obviously teaching, so I do recommend that if you ever are out on your own doing your own thing, okay? Don't burn any bridges. So anyway, let's get into this. I'm starting right here on slide 1. I'm going into slide 2. So what is an athletic trainer? Guys, there's literally, this is talked about all the time in our profession. It's like, what do you guys actually do? Because we see you all on the sidelines during sporting events passing out Gatorade. I hate that we have that image. I've been trying to preach to younger athletic trainers, please stop doing that. I know these colleges are more than happy to make an internship out of that if they need it and stuff like that, but for some reason, some athletic trainers still do that. But the overall definition is an athletic trainer is concerned with the well-being of athletes and generally assumes the responsibility of overseeing the total health care for that athlete. Now, when I get on later into this lecture, you'll see that it's just not athletes that we take care of anymore. You are seeing athletic trainers because of insurance changes. They are not just primarily with athletics. They're seen doing general population stuff, kind of the things that I'm doing now. Preventative exercises, because it does save companies a lot of money in the long run as far as like an insurance claim. We are the insurance, take care of the liability, obviously, in like a big factory or something like that. So when did we become known into existence? Well, it was kind of around the late 19th century, according to the NATA of the history of the profession, and intercollegiate interscholastic athletes in the United States. So this is just speaking in the United States. The way I see it, it's probably the kids that didn't make the team or something like that. And then they were just like, hey, you want to be a part of the team? Yep, start doing this, or passing out Band-Aids, taping ankles, and then it got into be more of a professional setting. So if we go on to slide 3, history of the profession. I like to show everybody the history of this profession because we are still very brand new. And that is basically if you put us side by side next to physical therapist, if you put us side by side next to physician assistant, any kind of medical field, we are still very new at this, okay? So in 1950, 101 athletic trainers met in Kansas City, Missouri, not 102, 101. And we formed what is known as our association, which is called the NATA, the National Athletic Training Association. Everybody that reports to, like let's say you're going into physical therapy, you will have a national organization that you report to. So ours is the NATA. It took us 24 years later, 1974, we started thinking, hey, we probably should be tracking memberships. So we started tracking memberships. And it was around 4,500 in the United States that were practicing as athletic trainers. Again, I don't know if we were just so busy, our founding fathers were just so busy, but it took us years later to finally, hey, I think we should start fighting for our profession, become legit. This is where it got big, and I want you to star this. In 2001, athletic trainers were recognized by Congress as allied healthcare professionals. So we are no longer passing out waters and passing out Band-Aids. Now we are allied healthcare professionals. We can do basically anything from looking at preventative exercises, which I'll get into in just a little bit, to basically looking at MRIs and seeing if you have either a fracture on x-ray or a torn ACL, so things like that. Okay, so present day, about 60,000 plus athletic trainers are still in the United States and growing, according to the NATA. So I have to tell you this because I don't know if anybody, and this sucks because I usually have a raise of hands in class. There's a thing that goes amongst our profession that if you call an athletic trainer, they will not respond. Me personally, guys, I really don't care, okay? And I'll go into that later on. But if somebody's in the heat of something, like let's say somebody's got a compound fracture, or somebody's not breathing and they're screaming trainer, 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 I am not going to sit there and go, nope, not until you call me athletic trainer. But I do have colleagues that they do that. So if you ever have run into that, or you might run into that, this is why. Because we have been taught we need to have the wording across in our profession that we are athletic trainers, not trainers. So the definition the comparison between the both is an athletic trainer is a highly educated and skilled professional specializing in athletic and orthopedic health care for the physical active. I like that definition a whole lot better than just what is an athletic trainer. So it's like just for the physically active. Doesn't mean just an athlete. It means for everybody who can, is just active in general. Okay. Trainer is someone who works at a gym, can work out horses, or train somebody to do something in a working environment. So if you ever run across, I think ESPN has even adopted the term athletic trainer, and they use it pretty well now. But if, just an FYI, just a fun fact there if you ever have that happen. So I want to look into real quick just the term sports medicine, because there's two different umbrellas under the term sports medicine. You have one umbrella that has performance enhancement, which is exercise phys, biomechanics, sports psychology, sports nutrition, and strength and conditioning. All of these are allies of us, okay? They are all tools that they can use for us as athletic trainers, or us as athletic trainers, we can basically refer athletes or generally active people out to them. Every one of these plays a role as a team. And what I mean by that, no matter what profession you're going into, I want you to understand it is not about your profession. It is about the patient or the athlete, okay? It's always about that. We have to work as a team. Moving on to the next slide. I'm on slide number 6 now. So the injury care and management, that's where we come under. And this is not really under any role of delineation, but I do want you to understand that physicians here in the state of Kentucky, and pretty much any state in the United States, they are at the top. We always take our orders from them. And then underneath it, it's athletic training, physical therapy. You have massage therapists, sports dentistry, and osteopathic medicine, okay? So again, we all work together. When I was an athletic trainer, I'll tell you that I always had either a fellow physician or one of my attendings at the clinic that I worked under, but they have to give us the freedom because they can't micromanage us either. That's where our allied healthcare professional education came into, I guess, in 2001, and I'll get more into that as far as the education background of this thing. But it was a really big jump for us in the profession, big time. So we all work together, and patients always first, okay? In order to become legit, in 2004, we had to take a board-certified exam. That certified exam basically said you have to come up with a performance domain or performance domains. Every legit healthcare profession has this, so you can look at physicians in general, different branches of physicians, whether you go into orthopedics or trauma or something like that, or if you go into physical therapy, every board has performance domains. So ours, we have 6 of them, and I want you to understand these because, hint, hint, you probably will see these on a test. They're not in any order. All of them are just as important as others. Me personally, I think some are more important than others just because of what I do now. So you have the prevention of athletic injuries, clinical evaluation diagnosis, immediate care, which is basically first aid. You're acting as a first responder. Treatment, rehabilitation, and reconditioning. So if somebody does tear their ACL or has an orthopedic injury, then we can treat them back. This is where we work with the physical therapist as well. Organization and administration. We basically budget out for our supplies. We either create a job. I mean, every school needs an athletic trainer, so we can bid for what we're worth. And then obviously every profession, I don't care what you're in, obviously needs professional responsibility. So it's like no drinking on the job, things like that. So those are our 6 performance domains. I am a big advocate of the prevention. I would love to prevent all injuries from happening. If I can do that, that would be great. And then some people are like, well, Brett, if no injuries happen, then how do you still have a job? Well, I'm there to prevent. So wouldn't you want to prevent so you don't have something happen? It's just one of those give and take things. Some people can disagree with me. I love prevention. So moving on. So your credentials. In order to become a certified athletic trainer, you have to go to an accredited athletic training program by a university. At one point, Eastern Kentucky University here in the state of Kentucky was the only university that you could go to get that. That's why I went there after high school. And it was a 4-year undergrad degree. Now it is a master's program. It's a 2 years master's program. So those of you who are still undecided in kinesiology, don't get all crazy. I don't know what I'm going to do, because there's still that option out there for you. Eastern Kentucky has it. I know Georgetown has it. I believe Northern and Murray State have it, okay? As far as the master's program for that. So once someone has successfully passed their boards, they are giving the credential ATC. It's not CAT because it is basically listed as Certified Athletic Trainer. I guess we just didn't want to be called the CATs forever, so they put ATC. So it's an Athletic Trainer Certified, okay? And then anyone who has not passed the BOC and practices as an athletic trainer, guys, that's against the law. It's basically against the law for any kind of other healthcare profession. If you say you're a doctor and you're not really a doctor, if you say you're a physical therapist and not a physical therapist. The biggest thing that was going on with us was physical therapists were saying that they were athletic trainers, and there is 2 completely different, healthcare professionals here, because we're trained on a lot of the same stuff, but there are different things, and it just becomes a complete nightmare as far as like what you can and can't do, who can say what, who can diagnose this, things like that. A lot of EMTs, they were acting as, oh, I know how to tape an ankle, so I'll just act as their athletic trainer for the team. It's like, no, they have to pass the boards now. We don't have a big problem with this anymore, but I will say 15, 20 years ago, this was a huge issue, okay? Moving on. So what I like to do is, what you all should do is look at your credential. What all does it come with? I was one of those rare people that want to know exactly what all does the ATC come with. I know I can do all this stuff that I learned in undergrad and other things, but I like to sell myself. Maybe I can get a little bit more money out of an employer because they don't have to hire somebody. They can just give me a stipend as far as equipment management and things like that. So I actually called the NATA and I said, hey, exactly what can I and can't do under this credential? So what I can do is I can do equipment management. We do take a class on that. Strength conditioning, we do take a class on that. Now, I will say with strength and conditioning, you're going to get into politics, because there are about 3 to 4 other strength and conditioning credentials that universities, like let's say you went to Division I, you want to be a strength and conditioning coach, they do like to see those credentials. So you'd have to fight kind of hard, even though you've already been trained on it and stuff like that. Just make sure you look into that before you start saying, hey, yeah, I can do strength and conditioning, okay? Nutrition, again, I can do some nutrition, and I like to give out nutrition advice. But at the end of the day, if a patient's really concerned about their nutrition, I'm going to pass them off to a certified or a licensed nutritionist or a certified dietitian, okay? Dispensing medication, that comes on state laws. So here obviously in Kentucky, you cannot dispense Class 1 narcotics. Hopefully nobody does that. But in other states, you can do that under physician's orders and things like that, okay? Not Class 1 narcotics, but just other medications, all right? Developing rehab programs, yes. Ensuring safe environment, absolutely. We'll get more on that during the semester. Personal training kind of coincides with strength and conditioning, and then research. Sometimes university, I know when I worked for Kentucky full-time, we'd have to do research every year and submit a research paper, which is good because it keeps you up to date on the new science and things like that. I cannot stand when you have a healthcare professional that keeps doing things that have been debunked the wrong way. It just makes me cringe. So I like when that's why basically CEUs are out there, continuing education units, and research helps with that. So I like to put this down, just kind of like an athletic trainer personal qualities, because some people don't understand what the profession is. They see these people like, oh yeah, it sounds like pretty fun. It's like, guys, it is long hours. It is long hours. It's a very unstable schedule, especially for those of you who are planning to have families and get married and things like that. There's a lot of time involved, you gotta love it. Me personally, again, I had 2 kids, and I got to where I was like, I miss them. It wasn't like I hated like what I was doing. I hate to walk away from it, but you just got to pick and choose. I have still best friends, colleagues out there that are still being athletic trainers. They're in and out every year. Hopefully, for those of you who had an athletic trainer, like maybe you were an injured athlete in high school, maybe you had a great person that you got to rely on as your athletic trainer. So it's like they have, you do have to have some of these personal qualities. I put down here stamina and ability to adapt. I think that's the biggest thing when people ask me, why do you love your job? Because it's the ability to adapt. I know that I'm not coming in, I'm not sitting behind a desk every single day, and I hate the cliche to say it, but I'm going to say it. Every day's different. It's like one day everything's great, and then the second day, all of a sudden, I could have 3 compound fractures, 2 torn ACLs. It's happened, guys. It's crazy. It's like injuries happen. They will happen. I put down empathy. I want you all to have empathy, but as you grow in whatever profession you're going into, empathy is, I don't want you to lose it. And what I mean by this, I'll tell you a little story. It's like, if I ever had an athlete tear their ACL, especially like a senior, no matter what sport. I had this one girl soccer player. She tore her ACL. She was senior. And it was the first game. And it's like, that's their senior year. And she was, crying. And for those of you who have ever torn their ACL or gotten hurt like this and it ended your career or something like that, it is sad, And you want to be there for them. And their parents are there. And everybody's crying. You're like, man, I am so sorry. This is terrible. And then after a while, you see 20 of them, and you're like, yeah, it's the same old song and dance. I know. Season ended. It's terrible. Boo-hoo. But the reason why I sit there and I have a little asterisk next to empathy, it's not because I'm some cold-hearted bitch or something like that. It's because I know that there's life after sports. Okay? I was an injured athlete once, too, and I was like, oh, I'm never going to play again, and yada, yada. It's like, guys, there's so much life to live after sports, and you're going to be fine, especially today's science. Everything will be fine if you do what the right things you're supposed to be doing, okay? And one day, sports is just not going to be there. You're going to have to grow up. You're going to have to do something for yourself, and you'll do fine as long as you don't let that consume you. So that's where I am with empathy, which kind of goes into my sense of humor. It's like, I hate when you're sitting there trying to talk to either a doctor, physical therapist, athletic trainer, and it's like talking to a wall. It's like, guys, they're hurt. You're in there for pain. They don't want to sit there and listen to that. Have a sense of humor. Try to develop some kind of personality. Lighten up the mood a little bit. And with that, you got to have the ability to communicate. If you do not have the ability to communicate right now, if you have a problem talking to somebody on the phone or ordering a pizza, this profession and probably 90% of professions out there are not for you. So you need to reevaluate that self for you, okay? And then I like to put on here intellectual curiosity. That's just basically, 1, not being afraid to ask for help. 2, looking at things outside the box. It's like, okay, I've seen about 12 ankle sprains a day, but this one looks a little different. I'm not going to just group it into an ankle sprain. So it's like, make sure you're looking at every single injury or every single problem, differently. Everybody has a name, and don't just label them as a number. And then obviously every job should have ethics, okay? Make sure you have ethics. If you have a problem being an ethical person right now, reevaluate yourself, because you're not going to be a professional. I can tell you that. You're going to get fired. It's going to be bad, okay? Real quick, role of the physician. So again, I told you we take our orders from our physicians, our team physicians, everybody at UK. That was a physician that basically I was under. I always told them about a couple bad injuries, but other than that, it's like, guys, they can't micromanage. They give me flexibility, which is great, because now it becomes a trust factor of the things that I can handle and the things that I need to bring to them, okay? So it's like, that kind of comes with professional responsibility, making sure that you are a good healthcare professional and you can be trusted, good decision-making skills and things like that. I do not ever do anything out of scope of practice. So if somebody lost their tooth, I'm not a dentist. I'm going to refer them to a dentist. If somebody's got something, like a heart condition going on, yes, I can recognize it, but I'm not a cardiologist. I got to refer them out. So make sure you understand how to refer them out when that situation does come up. And that goes for any time that you're graduated, whatever profession you're going into. Just plant that seed in your brain right now, okay? Make sure you do not go above and beyond your scope of practice, all right? Different settings for the athletic trainer. So over the years, we have gone out of the sports field, and we have been seen in other settings such as NASCAR. The industrial side is big, and the thing that is big about this is like Toyota, Ford plants, UPS plants are just some examples of this. They have hired athletic trainers on site because, 1, it lowers their insurance premium for employees, and 2, they know that they can get basically great health care right then and there, and they don't have to wait for somebody to go get an appointment at orthopedic office, take 3 to 5 days missing work. It's like we can have that in right there in-house. That is awesome. That is actually growing. And if anybody's ever interested in the profession, the industrial side is a way to look, because it is great hours too and good pay. Middle school sports, I don't know why athletic trainers weren't down in the middle school level to begin with, but over the past 8 years, they have been, because guess what? Middle school sports, people still get hurt. They actually get hurt worse than high school sometimes. Student health buildings for universities, I have been trying to preach for years for UK to create a job like that. That way if you're not involved in sports on campus and you're playing intramurals and you get hurt, instead of trying to go and get an appointment, you can just come see me. Right there on campus, boom, it's already paid for. There you are. So that's something to think about. I know some universities have that. It's really nice. Las Vegas shows, yes, they're active. Ballet, obviously, they're active. Police stations, fire stations, kind of goes into the same industrial thing. So it's like we are popping up everywhere, which is awesome, Now, for those of you who are going into physical therapy, I want you to listen to me right now. I do not hate physical therapists. Some of my best friends are physical therapists. But I do want you to understand that if you do go into physical therapy, some old school professors will tell you to hate athletic trainers. That's because we used to butt heads, and this was about 10 to 12 years ago, okay? Basically, they came out, they said that they wanted to, this is a long story short, they basically, the head of, physical therapy, here, and we'll just take the state of Kentucky, some lobbyist, this is all, what am I trying to say, politician stuff, but they basically said, hey, they should be taking their orders from us. And we said, no, we're basically the same. And you do your thing, we do ours, and that's what's up. And so basically, they took us to court, and there was a lawsuit. It got nasty, and they lost. And they said, nope, you guys are the same. And in 2009, the Supreme Court stated that PTs cannot state they are above the role of delineation of an athletic trainer. So that kind of was a bad taste in both professions for a couple years. I'll tell you guys later if you ever want to know. Just ask me. It's like it was kind of really bad at UK for a little bit, but then we brought it back together, and we all have a nice professional working relationship, and it's good because it's like we send athletes to them, they send athletes to us. We're all a part of the communication process, because at the end of the day, we are a team and we do work for the athlete, you know what I mean, or the patient. It does not matter. But I just want you to know, if you ever come across that and somebody starts saying that, just you heard it from me first. And there's sometimes where actually here on the next slide, some athletic trainers do become PTs, and there's nothing wrong with that. The biggest difference is in some states. So athletic trainers are now, fighting for this as well, but they are being billed for service. So physical therapists can bill for their service. So if you go in and get a bag of ice, they can bill $20 to your insurance. You will learn these codes if you go into the profession. Well, as an athletic trainer, how many times have you run in there and I'm just passing out 10 bags of ice after practice? It's like, we could make money off of insurance for that. I'm not talking about insurance scheme or anything like that, but it's weird how they can do it, but we can't. That's where kind of like the fight got into. So some states, that's in 2013, Indiana, Georgia, and Ohio do have athletic trainers bill for service, and those codes are called ICD-9 or ICD-10 codes, and it is great for the profession, because it's like, a lot of those athletic trainers are now getting higher pay. The hours are better. It's just a whole lot more worth to yourself. And it's like, I want you to understand that for yourself. It's self-worth. So there's a whole lot more states that have that now. It's not just the 3 states anymore. But again, I told you, most cases, athletic trainers and PTs do have a strong, positive working relationship. And when it comes down to it, it is about the athlete. It is about the patient. So little fun facts. What athletic trainers are not responsible for. I always like to put this down in class. We'll give you a little comic relief here. Dealing with non-athletic injuries from athletes. I cannot tell you how many times, guys, when I was working Division I at Marshall, athletes would go out and it's like, you know who you are. Sit there and get drinking, go to bars and stuff like that, trip, turn your ankle, break something, you know what I mean, and drunken injuries. And then they would call me up and they're like, oh, Brett, you missed it, man. You were at practice, or you weren't at practice. It's like, no, I know what you were doing. And it's like, they'll try to pull one on you, or like when I was working at Henry Clay, you get a school nurse that sends somebody down, and they're like, "Hey, will you take a look at this?" It's like, guys, for liability reasons, I can only look at what happened in practice or what happened, in the gates or on the field. So it's like we just don't deal with non-athletic injuries. Okay, coaches being responsible for treatment and outcomes. Most of coaches, a lot of them are my good friends. Again, I have great relationships with coaches, but there are some old school coaches out there that will be like, we're going to need him back in 3 days, Brett. That's what's up. It's like, yeah, so he's got a broken leg. I don't know what I'm going to tell you. And they think they can basically, uphold the treatment and outcomes. A lot of times Division I football has kind of got a bad taste for this. NFL, yes and no. I've got some colleagues that work up there now, and it's such a business in these things, guys. It's like that's why they think they can do the treatments and outcomes. Again, I'm not talking about all coaches. Very small percentage of the coaches now, because they don't want to be liable for saying on record, oh, I told them to come back way too early and pressured the athletic trainer or the doctors or something like that. So taking an administration role in their setting, because athletic trainers are always there. I literally had a couple people hand me the keys and be like, hey, Brett, we're going to go home and see our family. I know you're always here. Just lock up the gate and take the cash up to the office. And it's like, I don't do that. I can't work there. So just make sure you put your foot down. Okay. And then playing time. I cannot tell you how many times I've had said athlete, doesn't matter what sport, that's not very good, get hurt, and then I have to explain to their parents, hey, I am not in charge of playing time. I release them. You're going to have to go talk to coach. Well, coach doesn't want to have that conversation that their son or daughter is not very good, so they'll blame the athletic trainers for not releasing them. I've had that happen. I cannot tell you how many times. So just like some fun things you just have to be responsible for. Oh, and then I put up here water. Yeah, you can kiss my ass. I am not going to go over there. It's like grown women, grown men, you can go get your own water. And that's how I say it. And I will be a little cocky about that, because it's like I do have, 3 degrees, 2 of which are master's degrees. Not saying that I'm above it, but you can go get your own. There has to be a sense of responsibility for that. So it's just something funny. I don't know. The last one, guys, I do have an assignment here for you. All I want you to do is I want you to go to NATA. I want you to search for the Code of Ethics. I don't care if you copy and paste them. Okay, I know it's going to happen. But I want you to look, just make a Word document. Tell me what those 4 Code of Ethics, I think there's 4 still. Yeah, list the 4 principles of Code of Ethics. And then in one paragraph, it's not a right or wrong answer. I want you to tell me if you've ever been put in an ethical decision, or if you've had to make an ethical decision. If not, then tell me why it's right for an athletic trainer to make the right judgment call for athletes under 18. Guys, that's common sense, okay? Just make sure you do it. I want to make sure you're looking at your assignments and things like that. And guys, it can be something like, when I was in 4th grade, I went to Walmart and I stole a pencil. I mean, it's an ethical decision. I get it. I've had it happen in these classes. It's fine. You're right. It's an ethical decision. But other than that, if you guys have any other questions about any of this, let me know. I'm trying to respond to these emails as fast as I possibly can. And if you ever want to schedule to come meet me face to face, you can come out to the gym in Versailles. I'm totally happy to meet you. And then, make sure that you're putting in who you are and what you're majoring in. So other than that, guys, I will post another lecture next Tuesday. Okay, so thank you, guys.